in the last video we talked about some phase 1 exercises, and phase 1 should last 2 or 3 weeks, maybe longer, maybe 4 or 6 weeks if it's a rough case. But we're going to talk about phase 2, so after you've conquered all those exercises in phase 1. So Greg is doing some sit to stance here, so this is a great way to start strengthening your quads with some body weight. And so this is something that can be practiced. Again, everyone's a little bit different, but you can probably start practicing this within a month after surgery. It may take longer. And if you want to make it more challenging, if this is really easy for you, you can do it without the chair and just do some body weight squats.
Same height.
Yeah.
Essentially.
And just kind of go as deep as you feel is comfortable. And that's a great way to start challenging things again. I think for the next exercise, why don't we just start with some calf raises. So we talked about these in the prevention phases, but starting to stand on your tippy toes too is a really good way to start building up. You'll notice your calves on the surgical side start to atrophy as well, and so you can start doing these, and that will help build those calves back up. And these will eventually, you'll remember when we talked about prevention, we did some explosive calf raises on the edge of the step. This is kind of a bridge way to get you back to that point. So, and then in phase 2, we can start to do some lunges. So he's going to start to drop his knee down a little bit, but not a full lunge until he feels really comfortable to do it. And talking about the timeline, so everyone's a little bit different, and some people may regain the ability to lunge as soon as like a month or 2 after surgery, and some people might not regain that until 6 months after surgery. And so we talk about these phases and timelines, and we're kind of condensing it and giving you a pretty quick 30,000 foot overview here. But and we're breaking this up into about 3 phases. But just be aware that there's actually, these phases may take several weeks or even months. And some physical therapists and surgeons will break this up into as many as 5 or 6 phases and have it quite structured. But just know that as you get stronger, you want to start out with these simple exercises that are, inline exercises where you're not cutting and changing direction. You're just building a foundation of strength so that we can eventually get back to more dynamic type movements. And so as he does those lunges, he can eventually start to drop that back knee down a little bit further as his knee tolerates. And then this next one is probably not one we need to demonstrate, but people will often start jogging in a straight line, like in a really safe environment. And you can start jogging in place. Some people will use a treadmill or just jogging gentle laps around the gym. It's usually about 3 or 4 months before it's safe to start jogging. And you want to be doing it on a level surface where there's no chance you'll trip over something or fall in a hole. And just in straight lines and gentle curves. So on a high school track is a great place to do it.
Maybe hopping in preparation for that.
Yep, just gentle hopping.
Both legs.
Mm-hmm.
Cool.
And another good one for phase 2 is hopefully by a couple months after surgery, we're getting to the point where you can really bend your knee all the way. So a good standing quad stretch is a good one to do. So you can grab the back of your heel, grab back of your foot, and pull it into your bottom, and give that knee a good stretch. If you can't quite reach it, then one thing you can do is you can put like a towel around your ankle and grab the towel where it's not pulling all the way in. And you can do this in both the standing, or you can be laying on your side and do it on a bed as well. But that's a great phase 2 exercise to regain that motion. And Greg showed you on both sides, which I would also recommend, because what that does is it forces you to balance on one foot. So even when you're stretching the non-surgical side, it forces you to balance on the surgical side, which is a great stability exercise.
To the side.
Yeah. So we don't have an actual jump rope for this video, but jump roping is a great phase 2 exercise once you've gotten pretty comfortable walking and doing a little bit of jogging. That prepares you for phase 3. And then before we get into phase 3, so basically it's just a gentle transition from phase 1 going all the way back to the prevention exercises, which are very high level ones. And so you want to start to do some deep squats before you get into phase 3. So where you're dropping all the way down, and that should be fairly comfortable before we advance into phase 3 type stuff.
Maybe not all the way down to your butt though, right? Or to your heels.
If As long as it doesn't hurt, it's okay to do that, but don't torture yourself. Yeah, it's not going to hurt anything. Unless you've torn your meniscus and your doctor specifically, sometimes with a meniscus tear, which often happens with ACLs, the doctor will tell you not to squat real deep. But unless he indicates that, it should be safe to squat nice and deep.
So why would a meniscus make a bigger issue for it?
Because the meniscus is a weight-bearing structure. It's a piece of cartilage between your tibia and your femur. And if it's torn, sometimes when you're squatting deep, it just puts pressure on it in a way that can further damage the tear. So you need to give it plenty of time to heal up before you start to squat real deep. And the orthopedic surgeon will generally indicate when it's safe to do that.
Because they went in with the scope, they'll be able to see what kind of damage is on it probably.
Yeah, and sometimes they'll repair this meniscus damage. A lot of times they'll just trim it out, the part, like the flap that's torn up.
Because that's the part that's causing the pain, I would imagine.
Yeah.
Mm-hmm. Cool.
Yep.
Well, you're getting my heart beating again, so.
We're getting back to phase 3.
All right. Wow, that was a lot. So now we're into recovery phase. We've done phase 1, phase 2. You said that there was a third phase, but it was very similar to what we talked about in the video about prevention.
Yes. So phase 3 is basically preparing for return to sports. And so yeah, it looks a lot like the same exercises we did for prevention exercise. Prevention exercises are pretty high level because we're assuming we're working with an athlete who has not been injured. And so we want to gradually return to that, just in a gradual progression.
Yeah, but maybe not doing the full number of sets at the time that you're doing it at the beginning. You just need to get used to it. You don't want to, our biggest concern is, we're injury to recovery. We don't want to go injury to injury, so.
Yeah, that's a great point. So if you progress through the phases too quickly, you put yourself at risk of, re-injuring things and going backward. So as you progress along, just make sure you can have phase 1 conquered and phase 2 conquered. And then as you ease into phase 3, like one of the exercises was a weighted squat with the bar on your back. You might just start with your body weights and, like you said, a few repetitions, and make sure that gets easy before you start to add weight or before you start to increase the reps.
Yeah. No explosive lunges right away.
Yes.
Or calves raises for that matter.
Yes.
So, awesome. Well, yeah, we'll have a little link for that phase 3/ prevention phase for you in the video here. And thanks a bunch for watching. Any final words, Blaine?
So the last thing I would say is before you return to sports, so there's some specific testing where we have tools that we can measure how strong you're pushing on, how strong your muscles are working compared to your uninjured side. And we can measure like how far can you jump with your left leg versus your right foot. And we have a lot of data, we can measure all that, and we know like when it's safe to return to sports based on that data. So you want to make sure you consult with a physical therapist and get measured formally before you return to skiing or soccer or whatever sport you enjoy doing.
Yeah, and if you are an athlete, you probably want the data on yourself, and it doesn't really matter what everybody else does. You just want to know what you are doing.
Yes, it is. It is patient specific.
Awesome. Well, great. Thanks a bunch.
Thank you.